All right.
Hi, welcome, good evening, bienvenidos at the 4th Annual Thrive Community Showcase. I am Marcia Bruno-Todd, the Director of Programs and Community Impact for Leadership Tulsa, and here I have two amazing philanthropods.
That's correct. Philanthropods, yes.
Co-hosts, and we'll talk about them in a few minutes. But I want to share a little bit about what we're doing here. Thrive Tulsa is a Leadership Tulsa program, and it's really for folks that have come together and said, I have something in my community. I want to be able to contribute in some way. I see an adaptive challenge, which is complex. It requires multiple stakeholders. It's a big, hairy problem, and I want to be able to contribute and see the assets of my community. And that's exactly what this is. Everyday Tulsans coming together, wanting to serve our Tulsa. And I'm so grateful to say that this is our 4th annual, and grateful for our community sponsors and partners that have made this possible. That means we've had 4 years, 4 cohorts of folks coming together and investing in their community. And one that I liked really bragging about are the philanthropods here, my co-hosts, Chris and, what was your name again? I'm joking. Jesse.
Rude.
They are actually a product from Thrive. This was their impact project. Chris came from the first Thrive cohort, Thrive 1, first class ever. And Jesse came from Thrive 2, Thrive Harder.
That's correct.
And together, they realized that there was a need in our nonprofit community so they can better tell their story and get more folks in the community to engage, volunteer, and serve. And that's how Pod for Good came about. So go ahead and let us know more about that.
First, I feel like Marcia should write all of our advertisements.
For sure. It's much more precise and clear than anything I come up with.
We
for sure.
ramble, especially you.
Yeah. Well, some of us are exhausted after editing episodes.
It's nice when you can just come on and interview people.
It's true. It's pretty fun. So Pod for Good just celebrated our 2nd anniversary with the live stream literally right here where we are sitting right now. So there's our logo. It sort of covers up Marcia, which I don't know, feels weirdly appropriate.
Yeah. So we've had 58 episodes, and we have had so many amazing community partners. We've had political candidates. We've had activists. We've had private citizens. We've had people from across the gamut of people doing great things in Tulsa and the rest of the world.
So maybe rewind back though. So Pod for Good, there were a few years ago, you had an assignment.
Yes, I did have an assignment.
You had to do this right here, doing a community impact, showcase, showing your project. What really started? What was the impetus for Pod for Good? Why did it come about?
So the original idea came from the fact that I had spent a decade working in nonprofits, and I had noticed that no matter how much money they spent or time and effort they put into it, nonprofits were not designed to be good at sort of marketing themselves and selling themselves. Their employees and the people working there were passionate about the problem they were trying to fix, not necessarily about the best way of getting the message out. And so I thought, why not use podcasting, which is a very personal medium and not super expensive one, to help nonprofits use these tools to spread their message. And Pod for Good was really just the idea of what could be possible. And originally I had planned to help more nonprofits start podcasts, and I've done a little bit of that. But Pod for Good was just a way for a lot of organizations who haven't had the chance to really just tell us why we should care, the opportunity to do so.
And this was one of those cases where it was a skill Jesse had that was something that he loved to do anyways. Jesse and I had multiple failed podcasts by this point. Just us talking about nonsense, just nonsense. And I believe it was Marcia who helped Jesse come to the conclusion that maybe instead of fighting to try to come up with some elaborate solution, to find something he does well already and use it to help solve this problem.
And that was something like Thrive taught me, was we all have our inherent skills or skills we've developed in our lifetimes, and we sometimes forget the value of those skills. We devalue them because they're ours. And you taught us not to do that. So, and here we are 2 years later. So,
And Thrive taught me how to be more curious and ask questions, which is what I basically do. Jesse does all the real work. I just come on and ask questions or make fun of Jesse.
That is true. But I also mean, active listening is immensely important in podcasting, and that's another skill Thrive taught us. So thank you again
Yes,
to our
thank you.
fairy pod mother.
That's right. And Marcia was our very first guest.
That's right.
So if you want to learn more about Marcia, find our very first podcast, and you can download it, and you can hear all about her.
Oh, thank you. Well, it has definitely been a benefit for our community. And again, want to just kind of highlight the purpose of tonight. Tonight is just, you've got folks that went through the Thrive program. They went through a 10-month process, really diving deep into the community on different ways to go ahead and address adaptive problems, and then connect and leverage stakeholders so that we can work together and not work in silos. What I like showing is just 4 years, 4 cohorts. There's already evidence that these projects have come to fruition and they are serving our community. Another one of those is actually the Solid Foundation Preparatory Arts Academy. And in a few moments, you're going to have Jamie Broom, and she's an alum from the Thrive 3 class last year, and she'll be giving us kind of an update on how her project is going now and how you can best connect with her.
While we wait for Jamie, just to give you an update for Pod for Good, this is how bad I am at marketing myself. I should say Pod for Good has about over 7,000 downloads now, which, for a pretty niche podcast is actually pretty good. So, but if you haven't already subscribed, please do so. So, Jamie's walking up, and while Jamie's walking up, I'm gonna try to fix a technical problem. So, Chris, fill airtime.
Okay. So, one of the things that Jesse does that he didn't talk much about that came from this project, but one of the great things about his project and what Thrive did for him is it actually gave him the ability to turn something he loved into his actual career. So now Jesse, not only does he do Pod for Good for others, but he also has now able to be a podcast producer. He does live streams like this for people. He does editing. He does audiobooks. He does all kinds of things that are able to capitalize on his skills that would never have happened if it weren't for Thrive.
Thank you, Chris.
You're welcome.
All right, hopefully that fixed our audio problem. We'll find out here in a second.
Okay.
For those who didn't see our live stream, they won't know that we spoke with Jamie about a little under 2 months ago.
Yeah.
So, so first off, how are things going, Jamie?
Things are well. Things are well.
All right.
Do we have sound?
Is that a good? Things are going good, or volume needs to go up? Volume needs to go up. Okay. All right. We're having problems with microphone number 3 today. So,
Yeah.
Chris, keep going.
What? Oh, so I'm just, now I'm just still talking. I was going to say I could push my mic over and you and I could awkwardly share one mic.
Testing,
What?
is that better?
On all of us?
It's mine.
Okay.
So I need to speak a little bit louder.
Well, we'll see if we can get the volume up so you can speak at a normal voice. What? Here.
Hello, testing. Is that better? It's great. It's perfect. Okay.
All right.
Live streams. Yeah, adaptive challenge that we hopefully solved. Are we
right.
sharing this mic now?
Yeah, no. This
So
is,
she
this
gets
will
2,
be
we
great.
get 1?
Yeah.
Yeah.
This will be fine.
All right. Hopefully we'll fix that going forward. All right. So
Just occasionally lean in
That's
if I
right.
have something to say. Okay.
All right.
Sorry.
Back on topic. Listen, we can't do one of these Thrive showcases unless something is going wrong at the same time. For those who watched last year's, so
Oh my goodness.
live streaming, everybody.
But it was
yeah.
perfect for me. I mean, everything chilled out, and like when I did my presentation, it was smooth.
It's true. The internet
sailing.
blessed you during that time,
Yes.
and stopped me from having a heart attack on the internet. So
Introduction.
yes.
Do you want to? You have the mic, maybe. Oh, you have okay. Well, we want to introduce our first guest, which is Thrive 3. I don't know what your tagline was.
Was it
the threeviest? I don't know.
Was it Thrive 3,
The best.
the best? All right.
Period.
Okay, Thrive 3, the best class. We've got Jamie Broom, and Jamie is going to give us a little bit of an update on the Solid Foundation Preparation Arts Academy, which
Preparatory,
was her project. So, if you first, will you give us just a little bit of an update?
Okay. So this time last year, probably in October, we did the launch, right? Not the launch, but we did our Thrive project, presented that to the community. And December 1 is the day, December 1 of 2020 is the day that I launched the project via Facebook Live. So I let everybody know within the Tulsa community that Solid Foundation Preparatory Academy would be Solid Foundation Preparatory Arts Academy, which was the project that came out of me participating in Thrive. So December 1, we launched it, and immediately we started getting applications. But not only did we transition into a fine arts school, we went K through 5 tuition free. Yes, very ambitious. Didn't quite know what that meant at that time, but we started receiving lots and lots of applications. So as a result of that, where we had, we were in the middle of a pandemic, and so our enrollment really did dissolve to half of, the student body that we normally would have, from the first 17 years. So we were, where we would have 75, 80 kids, we were down to 45. So we started receiving these applications, and today we have 95 students enrolled in the school from pre-K 3 through the 5th grade. Now, K through 5 are the students who participate in the actual arts program. But, and then our pre-K 3 and 4, they'll get to see the artists sometime within next semester or whatever. So nonetheless, December 1, we launched, had all these applications in, and we didn't, we just kind of moved and was like really excited about it, but then kind of thought about it. It's like, oh, this is a lot. But we managed to kind of work through it, and we did things like we normally do in terms of how we ran the private school. We still did our summer program, and we focused on the arts as we normally do. We opened the doors August 18th to the full-fledged Solid Foundation Preparatory Arts Academy, where our students, like I said, K through 5th, are exposed and study the disciplines, the different disciplines. So what does that mean? So 8 to 12, they do their core subjects. So the math, arithmetic, reading, language, and such. And then they have lunch. And then at 1 o'clock, we break into those art programs. So our K through 2nd, their mandatory class that they must take is percussion. And our 3rd through 5th, their mandatory art class is strings. So we'll have a little orchestra. And then they have 3 other classes that they can choose from. So they'll take 3 classes. So the choices are visual arts, dance, theater, and piano. So they each of the students have 3 classes that they get to study through the course of the week for at least an hour a day.
So why did this type of education sort of call to you? Why do you care about it?
Why? I love the arts, and I know what it does for me when I can't sing a lick. Tried out for a play, and I found out that I can't act either. I love the arts. I've grown up. My mom is classically trained. My grandmother, classically trained. All the members of my family, they play some type of instrument, or they've danced, or they've done something within the arts, and so I just kind of grew up with that. But I know what art does for an individual. I've seen it, just manifest through the kids that have come through the program, and how it just, it just ignites that spark within them, and they become like a totally different person. And it increases their self-esteem, that confidence. When you see them on stage, you're like, oh, look at Johnny there. I know what it does. And so I just wanted to be able to provide that opportunity for our kids because they're not getting it in the public schools as much as we're getting. Like, they may have specials and they may go twice a week for about 30 minutes or so or whatever, but nothing like what we're able to provide for the kids at this moment. So what does that, why you ask, is because I know that it will help them not only on the academic side, but it also will help them to be a more, I'd say creative person, but someone that thinks outside the box and someone who can think differently, and kind of rationalize a little bit better than those who are just stuck in the box, I guess.
I think that makes a lot of sense. And, the interesting thing is a lot of what you described are also skills that we picked up in Thrive class, right? So what are some of the things that you took from Thrive that helped prepare you for this transition?
It's a lot. I think, just surrounding myself. I don't know if the terminologies and the wording and all that stuff, it slips my mind. But what I do, what I did get out of that is just a sense of, some confidence, and being able to speak to the need, right? The Thrive class, teaches you about, what advocacy and what impact is happening within the community, and having you look at what's happening, not only citywide, but what's happening in your area. And so being able to take those, what do you call it, the skill sets that they've given us, and kind of compartmentalize and, put the first things first, and prioritize what is most important. And then is that something that what you have a desire to do, is that really what the community needs? And so being able to evaluate that using the skills that we were given, was able to kind of push forward. I don't know if that makes sense.
And so, arts education is something that's sort of getting cut all over the board. But in this particular case, did you have a particular place in mind that you wanted the school to be in?
In terms of location?
Like, yeah, in
physical?
terms of location.
So we were already in North Tulsa, between 36th and 46th Street North. We already had a building. So that wasn't the issue. It's just, how do you transition and making sure that you have enough space and everything. And it turns out we may need a couple of prefabs, because we're sharing space. It's like, oh, okay, you can't be here today, but tomorrow let's try it out. So where we're at, it's adequate, but I know that as we grow, or as we, add, more classes and, students or whatever, we will need some additional space to be able to facilitate the program successfully.
And I believe you told us when we spoke in October that you were having something this month that people could go to or give money towards. Can you remind me what that was?
You can always give money.
Yes.
You can always give money. That's one of the things that, one of the resources that we definitely need. But we'll have a Christmas program this month. It'll be December 19th. We'll have 2 shows, 2 and 5, and it'll be at the school. So it'll be limited seating because we're still being COVID cautious and everything. So tickets will be $10 for adults, $5 for children. And so it'll be similar to like a recital, because we do want the kids to be able to perform. And, up until this point, they've learned quite a bit. And now I think they're able to either pluck on the strings or twirl a little bit because they've learned a couple of skills. So we'll have that in December. January, we'll be prepping for our annual gala, which is a Brass and Sassy affair, which will be, fantastic. It's a phenomenal gala. It's always a phenomenal gala, but the theme is the recital. So it's going to be a show that you do not want to miss. But we have different events that'll lead up to the actual gala. So January and February, you just look for all of our things to come on out.
And if I remember right, you also mentioned last time that you were working towards a performance next year of The Wiz.
Oh, yes, yes. Our end of the year performance is going to be The Wiz. And it'll be the movie script, not the actual Broadway script, because I just love the movie more so than the Broadway script. So we kind of translated that, and I've done it before. I mean, The Wiz before with another organization, and so I'm very, very familiar. I can do all the parts, all of them.
I would pay good money for the Jamie Broom one-woman performance of The
Come
Wiz.
to mama, you
So-
hot little digits. Let me lay my 2020s on you. Mwah, mwah, let me count them. Oh, I know. Yes.
Well, now I'm just going to dream about that. So,
That's Miss One, if you didn't know.
well, Jamie, thank you again. Thank you again for taking time to talk to us about this really awesome, just arts academy. Both Chris and I are not known for sort of those type of artistic skills, but I know we both enjoyed them immensely. So, and weirdly enough, I never imagined that learning music, learning how to play an instrument in the 6th grade would actually affect how I audio edit a podcast. But those things do relate in weird ways.
Yeah,
So,
because you're able to hear those.
yeah,
notes and
I hear
stuff.
things I wouldn't have been trained to hear before. So,
Right. That's a great
Anyway,
example.
just in case anyone didn't know, arts education's important. So,
Very.
go ahead.
Well, so before we do let you go, why don't you let everyone know how they can connect with you, how they can connect with the school, and how they can help you out.
Okay. So we, Solid Foundation Preparatory Arts Academy, and as you can see on the screen, there's many ways that you can support. And as I mentioned earlier, our financial support is one of the biggest resources that we are looking for at this time. So we have a Cash App that's available to you. All you have to do is just dial that into your phone. PayPal to sfpaeagles@gmail.com, or you could stop by. Now, last year I told you couldn't stop by because you could just drop your check off. We'll let you in this time. We'll let you in, let you see the students and everything. But we're located at 4025 North Hartford Avenue, right, like I said, between 36th and 46th Street North. You can give me a call. I'm at 918-794-7800. If you just want to come in and see, if you want to volunteer, we have plenty of opportunities for that as well. So, I mean, there's a lot that can be done, and whatever you think that you have a skill to do that could enhance or impact what we have going on, give me a call, and we welcome you with open arms.
Well, thank you again, and for one of the amazing success stories of Thrive Tulsa. Yay. And good luck with the school.
Well, thank you so
Thank
very
you.
much, and good luck with Pods for Good.
Thank you. Okay, it'll keep going until it kills me. Well, so now we're ready to start the showcase for this year's Thrive class. So we're going to start with Michelle Sullivan and donation duos. So let's see that awesome video/presentation.
Hi, my name is Michelle Sullivan, and I work for BOK Financial as an institutional advisor. Our team manages money for nonprofits, foundations, endowments, tribal entities, and so forth. I'm also very fortunate that I was selected this year to participate in Leadership Tulsa's 2021 Thrive Tulsa program. And I appreciate the opportunity today to come and talk a little bit about my nonprofit project, Donation Duos. I'll go ahead and kick it off by just saying I really believe that Tulsa is blessed with having so many nonprofits to support our community. I've gone out to governing.com's website and was surprised to see, to some degree surprised to see, that Tulsa actually has more nonprofits per 10,000 people than large cities like Jacksonville, Florida, or even Dallas, Texas. From my personal experience, as mentioned, I work with nonprofits. It's my day in and my day out. And still, every couple of months, I'll run across a nonprofit that I haven't heard of before. Truly, I think what we have is a lot of hidden gems in our community that really just need a greater level of exposure. So my project is to provide a little bit of that needed exposure by making connections between school organizations and nonprofits, and hopefully making a little bit of money along the way. The how-to is relatively simple. It would be by going out and encouraging the school districts to fundraise with nonprofit merchandise. There are a lot of organizations that currently have a structure like this in place. So, for example, New Leaf. A New Leaf has flowers that organizations can fundraise with. Altmont Bakery has their delicious cookies. So there are programs that are established, but even if you're a smaller organization, it could be something as easy as using clients' artwork to create some sort of greeting card that can be marketed. So there's opportunities really for just about any type of nonprofit organization. So where I am and how I am making this project specific is really, it hasn't been an easy, quick matchmaking event where it's swipe left, swipe right, but I have been able to make some progress. I've reached out and coordinated with a local school district's parent-teacher association, or PTA, and they will allow us to bring in up to maybe 3 nonprofit organizations, have them present about their organization, their mission, and their fundraising opportunity, and present to all of the representatives for the district-wide PTAs for those local schools. Now, the other part of the partnership is really determining what nonprofits to work with. And again, there are so many amazing nonprofits. It's truly a big process to go through and to make sure that I find some good matches, especially here as the initial pilot would begin. Which I'll go ahead and put a plug out. If you work with a nonprofit or know of a nonprofit that would be a good partner in this program, please feel free to reach out. My target date would be towards May of next year, around graduation time. I think it would be an exceptional idea to be able to sell flowers, thank you cards, congratulatory cards around this time frame. And the one thing I want to mention is that I'm really excited about the idea that this exposure could grow exponentially. As mentioned, the first initial presentation would be to a very large group of PTA representatives. There's your initial exposure. But then those PTA representatives go back to their local school sites and share that information with all of their members. And there's another bit of sharing that goes on, even if the organization doesn't intend to use the fundraiser. But if they do decide to participate, then that exposure continues to every individual that they try to solicit a donation from. So it's definitely a win, and I can see it spreading the word about nonprofits very quickly. But let's remember that this is a lot more. This is about a lot more than just fundraising. One of the major reasons people donate their time, talent, and treasure is because they have a connection to an organization, their mission, their story. So let's get those stories out, start those connections. If you are interested to work with me getting this project going, please feel free to reach out. Or if you know another nonprofit or are familiar with someone that may be interested in participating as part of this program, then again, please do reach out. Thank you for your time.
All right. And hopefully Michelle is with us here in a second, and we can ask her some more questions about donation duos, because I'm curious about it. Hello.
There we go. You're kind of cut off.
I'm cut off now, but it's
You're on
fine.
screen. That was perfect.
Hello. There
Okay,
we go. I
there
think.
we
Good evening.
Thank you, Ed.
Can you all
evening.
hear me okay?
Yes,
We
yes,
can.
we can hear you.
Thank you.
So I guess we'll start off with so why donation duos?
I think I hopefully I try to address this a little bit in the video, so I'll try not to be redundant, but I work in the nonprofit space. I manage money for nonprofits, foundations, endowments, and so forth. And I feel like, gosh, I am so tied to this community. I know so much about so many nonprofits, but there are so many in Tulsa that do so many amazing things that I just haven't heard of, and they're always popping up. For example, your podcast, I hadn't learned about it until I was part of Thrive Tulsa, and I'm so excited to get on and subscribe, of course. But I think there's lots of nonprofits out there that need that extra exposure.
For sure. We were curious, have you identified any specific nonprofits that you think will work with your program?
That's probably been my hardest or my largest challenge, is to narrow it down, because I want to make sure that I am matching up with a nonprofit that really does need the exposure. I mean, I think there's some nonprofits that really know, but at the same time, in this pilot, I really want to ensure success, and I want to make sure they're comfortable in doing something like this so close in May. So that's part of what I'm still working with. I've talked to a few organizations, but I don't want to put anybody on the spot here. So still in progress.
I was going to be like, I feel like Leadership Tulsa would kind of have to do it, right? I mean, so, we were watching your presentation, and I'm curious about why, and with your work with nonprofits, what was it about the building community aspect that, I don't know, I'm trying to phrase this question, like, it made complete sense when you mentioned that, like, of course, people donate because they feel attached to a cause and they feel like a part of a community. So why not take, like, PTAs, for example, that are groups that are already part of a community and get them to help fundraise for nonprofits? It's one of those ideas where I'm like, why? Like, has this been tried before?
Yeah.
Like,
Why is this
like,
not already being done?
Yeah, why does this seem novel?
Yeah.
Yeah, that's great because, and I have 5 children, so I can tell you that we have been involved in, or I have been involved in countless sports teams, dance teams, all kinds of different things that we have sold.
So a lot of chocolate bars, I'm guessing.
Exactly, right? So, but I think there's only been one organization that has sold a new leaves, flowers, poinsettias during the holidays that I'm aware of. And I have to stop and pause and think, why aren't we helping each other? So I don't think it's a novel idea. And I think there are organizations that are out there doing it, but it's really about just getting those connections. And change is hard. If you're a team that's been out there for a long time, you're doing the same thing all the time. It's the same fundraiser, especially when nonprofits have them as established. I think some PTA organizations, especially when you get to the older kids in high schools and so forth, they struggle a little bit more in fundraising just by the nature of the organization. But I don't pretend that this is novel. I'm just trying to help the connections here in Tulsa.
Do you have any Bank of Oklahoma related questions for her?
Yeah, fire away.
No, not specifically, but no. Also, you're getting a lot of kudos in the chat. I don't know if you can see that, but you're getting a lot of support in the chat with that. But no, I'm kind of fascinated by the concept of tying together sort of different groups fundraising, and the New Leaf example is a good one. It's an existing one, but I am curious for organizations that don't already sort of produce something for fundraising, what kind of opportunities they would have. I know you mentioned greeting cards as an example, but I'm just trying to think through what other opportunities would there be.
Yeah, that's a great question. Thank you. I think that the reason I came up with greeting cards is I know there are some nonprofits out there that do currently have that as a fundraising mechanism. I think some utilize it more than others. But what I like about it is that it's easily scalable, and it's not something that has a lot of upfront cost or work that goes into it. So I think for an organization that doesn't have a program in place, using a client's artwork, I'll give another shout out, the Center for Individuals with Physical Challenges. They have amazing clients that will do artwork. I believe they're still doing this program. I should put that caveat out there, but and even have their clients customize it for you and then put those in packages for holiday cards. So it's that, again, isn't necessarily novel, but it's easy. And I think it's those nonprofits that don't already have those established programs that are probably would most benefit from something like this. But I think that if they have great ideas, that as long as we can make sure it's scalable and suitable to be and ready to be successful, I'm on board. I'm not I'm an investment person, so I wouldn't put myself in a category of the most creative. So happy to work with people and just make things happen.
Well, I know it was at the end of your presentation, but just before you go, how do people get in touch with you if they work for nonprofits or are connected with nonprofits that would like to be involved in this?
Sure. Yes, absolutely. I do have a Gmail account that's for this program. I cannot remember what it is, but msullivan@bokf, like financial.com. Feel free to reach out to me in my work email in regards to not only if you want to be a part of trying to help me get through this and work and make it happen, but if you know of anyone in the nonprofit space that would be interested in partnering, then I'm happy to have a discussion. Thank you.
All right. Thank you again.
Thank you, Michelle. And so now we are going to move on to our next presentation, which is Ajay Joseph. Hopefully I pronounced that correctly, with lifestyle medicine.
Good evening, everybody. My name is Dr. Ajay Joseph. I'm a cardiologist at St. Francis Hospital. I came to this country about 10 years back to start my training at the Cook County Hospital in Chicago, which is basically a safety net public hospital which focuses on providing care to the underprivileged, irrespective of insurance, immigration status, etc. My training there made me acutely aware of the subject of healthcare disparity. This subject, unfortunately, has followed me to Tulsa as well. This is a slide from the Tulsa Health Department which basically points out a sobering statistic. A child born in North Tulsa today will live 10.5 years less than a kid born in South Tulsa. I think this is a number which should give us all a moment of pause. Why is that so? Why this big a gap? From a socioeconomic perspective, there are multiple reasons which are out of the scope of this discussion. But from a medical perspective, let's make it a bit more granular. The issue of healthcare disparity was exacerbated even more when COVID struck. As this slide from the CDC points out, hospitalizations and deaths were twice more likely in minority communities. As you're all aware, the folks who suffer the most from COVID, who die the most, are the ones with underlying chronic conditions, which again are far more prevalent in minority communities. So what are these chronic diseases? This slide from the American College of Lifestyle Medicine sums up the gravity of the issue. Chronic diseases or lifestyle diseases are obesity, heart disease, cancer, diabetes, stroke, dementia. A staggering 6 in 10 Americans have a chronic disease. 4 in 10 Americans have 2 or more chronic diseases, and half of all Americans have heart disease. Now keep in mind, these numbers are way worse in minority populations, and that's one of the main reasons for those last 10 years that we talked about, as well as the disproportionately increased mortality from COVID. But there's good news. Most of these diseases are the result of just 3 factors: a poor diet, lack of exercise, and smoking. All 3 of which are more prevalent in minority communities. And the solution is addressing these factors in a holistic way rather than simply throwing pills and procedures. Addressing the root cause, closing that overflowing faucet rather than simply mopping the floor. Lifestyle medicine is the newest branch of medicine which tries to treat lifestyle diseases with lifestyle measures, the so-called 6 pillars of lifestyle medicine, which are a healthful eating pattern, increasing physical activity, developing stress management strategies to manage stress better with yoga, mindfulness, meditation, forming and maintaining relationships, improving your sleep, as well as cessation of tobacco. I'm in the process of starting a program at my hospital wherein about 10 to 15 patients would come together in a group and would be taught various aspects of lifestyle medicine. However, I realized that ironically this program at the hospital will not address the people who need it the most. And similar to my alma mater, the Cook County Hospital, I wanted everyone to have access to this program, irrespective of insurance status, immigration, etc. And that brings me to my Thrive project. The program I envision is free for all, a 2 to 3 hour session once a month to begin with, in an informal group format, where I bring together like-minded, passionate individuals. For example, I would have someone who would talk about stress management, mindfulness, meditation techniques, a simple teaching kitchen where folks would be taught to cook simple, healthier dishes, cooking healthy on food stamps, for example, making healthier choices at the local grocery store, how to read food labels better. I would have someone talk about the benefits of exercise and connect them with resources for exercise, which might be the local Y. Similarly, I hope to have someone discuss addiction issues, be it smoking, alcohol, or drugs, all in all a program which addresses the 6 pillars of lifestyle medicine that we talked about. Because when you make the lifestyle of a family healthier, you basically change the trajectory of that family. And those healthy changes have a ripple effect on the friends of that family and the community they live in. Through Leadership Tulsa, I've been able to connect with some incredible people who I think will be critical to making this program successful. Now, this is a saying that's attributed to the father of medicine, Hippocrates, about 2,500 years back, and this cannot be more prescient and appropriate with what we're seeing with COVID these days. I want to end by thanking the folks at Leadership Tulsa and Marcia, Michelle, for the incredible learning experience that Thrive has been. Thank you for mentoring us, helping us make those connections, which are so vital to the products that we're pursuing, for helping us meet some incredible people as part of this journey. And above all, thank you to my class for all the support that you've given to all of us. You guys really are the best, and I wish you all the best for all the products that you're pursuing. This is my email address and my cell number. If you have any questions about this project or anything else that I can help with, please feel free to mail me or call me on my cell number. Thank you very much. All the very best, and have a good evening.
I always forget, like, the role healthcare plays in every issue that, especially in Thrive, that you learn about. So that was, again, a very useful reminder. Now, hopefully, we will hear from Dr. Joseph himself. Are you with us?
Yes, I am. Sorry
Hello.
about that. There was some bit of a snafu here.
Listen, this is live streaming. This is how it works.
Yes.
It's okay.
And beside, your video was playing. Nobody even knew that
That's
there
right.
was,
Yeah,
that anything was going on.
They know now, but they didn't know
Yes.
before. So, why this issue? Why Tulsa? Why now?
Yeah, I did my training at Chicago, and the Cook County Hospital is a hospital which is basically whoever goes through that hospital, who trains at that hospital, calls it the 3 best years of their medical training, because you get to see the whole plethora of disease processes as well. Besides not just disease process, you see the socioeconomic aspect of that as well. And that's what basically changed the way I look at disease, because you cannot be just focusing on just pills and procedures. You got to look at the foundation, what's causing that. And that healthcare disparities and healthcare inequities has been my passion since I trained at the Cook County Hospital there. And when I came here about 3 years back, after I finished my training and all that, obviously when I was still in my I just wanted to do something about it, and I just started to do some bit of my research, and what I found was just absolutely stunning. I mean, as I pointed out in my slide, I mean, the fact that you have a 10.5-year difference in life expectancy between 2 areas in the same city, that's just not good. That's just not good. So that was a sobering statistic. And then of course the last year and a half, it's just been everybody's been affected by COVID, and I'm sure we all know, it's the folks who have all these underlying conditions who die, who are the most risk. And that this past 1 year has just made it even just exemplified the whole issue. So yeah, that's why now, better late than never.
Well, you talked a lot about what lifestyle medicine is, and it is a growing discipline.
Right.
So what about it can have a powerful impact on this problem?
Oh yes. So diabetes, obesity, blood pressure, heart disease, they're all basically, there's no reason why. There's absolutely no reason why folks should have blockages in their heart. There's no reason. I mean, if we follow the right things, it's a lifestyle disease. It's purely a lifestyle disease. And the same goes for diabetes as well. A lot of diabetes, some of it is, of course, genetic, but about 95% of that is literally purely related to our lifestyle. So if you think about it, if you compare folks who just a simple study of there was a study that they did in Europe where they compared folks who exercise, not Europe, in California, the Kaiser Permanente healthcare system. So they compare these folks who walked or exercised half an hour compared to the folks who did not, and the mortality from COVID was staggering. Was about 5 times more in the folks who just exercised half an hour. So just think about it. Just exercising half an hour decreased your chances of dying, because you're healthier, your lungs are healthier, you're lesser at risk for getting problems when you get sick. So those 5 aspects of 6 pillars of lifestyle medicine, each of them have such a critical role when you talk about health, when you talk about COVID, be it just COVID, be it diabetes, be it everything. So yeah, there's just so much to talk about on that aspect itself. But yeah, this one year, if you've learned anything, it's just keep being healthy, just by doing simple things like exercising and eating healthy. It makes a life. It makes a it's a big difference when it comes to outcomes from COVID.
Well, and we're running a little short on time, but can you tell us how people can help out with your project, can partner with you and support you?
Well, yeah, as part of LT, I mean, leadership of this class, I've had a chance to meet with some really awesome people who I think are going to be incredibly useful for my project, especially Katie Plahaki. I've talked with her, and she's somebody who might want to work with. Meg, who's part of my cohort, who's going to be, who I'm hoping to connect with. So I do have been able to lay the foundation stones for that matter, for this thing, and I'm hoping to get some support from my hospital as well. There have been some leadership changes in my hospital, and the new leadership is looking at this in a very positive way. So I'm hoping for things to start off quite soon in the next few months.
Well, Dr. Joseph, thank you for joining us on this live stream, and we wish you nothing but the best in this incredibly important project. So thank you.
Thank you very much.
So now we get to hear from Jeremy Simmons and his, I love this already, the harm reduction vending machine.
Hi, I'm Jeremy Simmons. I'm a clinic coordinator with HOPE, which stands for Health Outreach Prevention Education Incorporated. Two of the main things we focus on is HIV testing and Hep C testing for free. My project that I want to talk a little bit about today is a vending machine that has harm reduction supplies. And that's going to be a lot of harm reduction supplies focused on people who use injection drugs and reducing their chances of accidentally overdosing or getting hepatitis C. Unfortunately, at my clinic, we have to give way too many positive results, particularly for Hep C. And in Oklahoma in general, we have a much higher rate of Hep C and a much higher rate of accidental overdose death than most other states. From a personal perspective, I've seen that firsthand as well with a very good friend of mine who accidentally overdosed. And that's a personal experience that way too many Oklahomans have had to go through. So, what are some of the ways we can help with that, right? One of the reasons people won't access services is because they feel awkward about interacting with people. And so a vending machine allows a certain level of anonymity for people who have shame around what they're doing or are afraid of being caught, okay? Also, it's a program that while it's new to us and it's new to Oklahoma, we think, it's a program that has shown some success in other cities. Gilead has graciously agreed to fund the program already, so we have the funding in place. We have some of the plans, which our new employee, Alexa Bottoms, will talk a little bit more about soon. We have, one of the unexpected challenges was we had expected to have this hosted at another site where people could access it in another area more easily. We are probably going to have to start it off at our main clinic. So there have been some adaptations made, but we have the funding for it and we have some of the models. And I'm going to let Alexa talk a little bit more about that.
Hi, my name is Alexa Bottoms. I'm the Harm Reduction Outreach Specialist with HOPE and Oklahoma Harm Reduction Alliance. The Connect vending machine was started as a collaborative project between the two organizations in an effort to provide low barrier access to folks who use drugs to both harm reduction supplies and safer sex materials. Following production, the Connect vending machine will be housed at HOPE's testing clinic located at 3540 East 31st Street in Tulsa. Participants can enroll in the program through a staff member at Okra or HOPE, in person, online, or via referral through our partner agencies. The initial machine will carry 4 types of kits: a safer sex kit, safer snorting kit, a hammer kit, and a bubble kit. In our safer sex kit, participants will find external condoms, internal condoms, lube, hand sanitizer, and masks. In our safer snorting kits, participants will find straws for individual use, sterile plastic razor blades, as well as safer sex supplies. These are our hammer kits, and these are our bubble kits. In addition to these kits, participants can also access sterile syringes as well as disposal bins for the collection of used syringes. Our machine will also include Narcan and fentanyl testing strips. Research shows access to safe supplies like these greatly reduce a person's likelihood to contract or transmit illness or die as a result of drug use. Once enrolled in the program, participants are given a unique ID number which allows them to access supplies in the machine. Participants are also linked to other services provided by Hope and Okra as well as their partner.
Alexa and I want to give a huge thank you first and foremost to Gilead for agreeing to fund this project. For the director at Hope, Taryn Norman, and the co-directors at Okra, Haley Ferguson and Andrea Haddix, for helping out with the brainstorming, implementation, and grant writing on this. And I also want to really thank the team at Leadership Tulsa and my cluster for giving me so much great feedback and a space to talk about some really awkward topics and make this a much more successful program.
Again, another like, why doesn't this exist already? And that's one of the things I love about doing the showcase is like, I'm like, oh yeah, why isn't that a thing?
Yeah.
So let's bring on Jeremy and talk to him more about this awesome idea. Hello.
Hello, Jeremy. Hello. So my first question is, for people that may feel distant from this problem, they feel like that this particular issue doesn't affect them, why should it be important to them? Why should it matter to them?
That's a great question. So unfortunately, every year for over a decade, Oklahoma has been in the top 10 amongst new Hep C infections as well as accidental overdose rates. So a lot of times, I think particularly people in the Midwest tend to feel like drug use might be a big city problem and they tend to distance themselves from it. But actually, a lot of the Southern and Appalachian states have much more of a problem with Hep C and overdose than the other places in the U.S. So, and obviously that's directly felt by the people that die in the most intense way. And from a big picture perspective, it's doing ambulance pickup, ER visits, ICU visits for people who have overdose reactions, and doing the long-term care and treatment for Hep C is something that the state spends an enormous amount of money on. So it's just doing prevention just saves people from dying in the most extreme situation, but in the midterm, it keeps us from spending so much money on treating the problem at the end.
And so, I mean, I guess why a vending machine over, packages or places where people can go to pick it up? Like, why the vending machine as the vessel for this?
That is also a great question. So we partner a lot with SHOTS and the Oklahoma Harm Reduction Alliance, and they have direct distribution and mail out. So there is already some of that being done in Tulsa. But there are still some people that won't access that because they don't want to engage another person. There's so much stigma around this, and some people are so afraid of being arrested or losing a job or losing their kids or whatever if people find out they're using drugs, that they can get so fearful of that they won't access safe sex supplies or, more importantly, injection drug use related harm reduction supplies. So we're trying this. We researched it quite a bit, and it's been shown, like I said in the video, to be successful in some of the larger cities at catching some of those people that just won't access us otherwise.
And I know you mentioned that you are going to start out with it at one facility. Do you have plans to expand to other locations, other partner organizations?
I would love to do that. And so we really wanted to focus on injection drug use related harm reduction on this round, in part because there's a new law. So it used to be illegal to hand out pipes or needles in Oklahoma, and there's a law that went into effect December 1st, changing that. So we knew that there was a law coming that allowed us to be a little more free with promoting this. The one catch, and one of the reasons why that Alexa didn't talk so much about a couple of the kits, is because it's not illegal anymore, but you have to register as an approved site with the state health department, and the state health department doesn't have a format for that. So in typical sort of state of Oklahoma fashion, they actually made an improvement, but then the catch was you have to register and there is no registration process. So we have the funding, we've ordered the machine, we're hopeful it'll be here by February, the latest. And hopefully by then we can register to legally distribute needles or do it anyway and then cross that bridge when we come to it.
Yeah.
So, but she didn't. That's why she kind of was a little sparse on describing some of the kits, because we were like, well, maybe we shouldn't say in a video that we're sending out to the world that this machine will have needles and pipes in it, because technically it's still illegal. So we're in a little bit of a gray zone, but we are, the guys at Majestic are really interested in us having a machine there that's a little more focused on young gay men and young heterosexuals that frequent that club. And so I would like to do a second machine that has more of a sort of a young person's safer sex harm reduction angle. And we've also talked about distributing some rapid HIV tests that people can do. Am I there?
You're still there. Yeah.
Okay, but that has some pros and cons too. So there is another place that already says, yes, we want one of these. So, but we're going to work with the first one and have it in the clinic, which again, wasn't my main goal. But when we talked with Track B, the provider, and some of the other cities that have done these programs, they said that actually in the first several months or first year or two, they had to do it at their main site just so that they could get community partners and funders and health department and everybody familiar and comfortable with it. And then they were able to place it in another location.
Well, excellent. Ed's really taking care of a lot of my questions. He's put on the screen like how to find out more about your about this project that you're doing. But for the people watching, like, what is the best way and what's the best thing they could do to help you with this?
So the best thing they can do, honestly, is the main thing we need before we get more machines going is funding. So going to hopetesting.org and donating. If you're interested in helping out in the clinic in a more hands-on way, I can actually train people to become testers and counselors. So we have other opportunities for people who can't donate funding. So we can actually train you how to do some of the limited sexual health services that we do here. So people who want a more hands-on experience, just let me know and I can train them to be a tester.
Well, thank you again, Jeremy, for this really important project, and we wish you all the success in the world with it.
Thank you so much.
Oh, we do have one question that popped up, and that is, can a business reach out to you to place a vending machine at their location if they want to?
Yes. So we are going to get the first machine in, do some trial and error stuff with that in-house. And then, like I said, we are probably going to work with Majestic as our second site, hopefully. So other sites, I'm happy to do it. The machine costs about $9,000. So there's a little bit of an initial investment. So that's the biggest barrier. So dropping off the supplies, maintaining the machine is not that labor intensive or costly, but so that's the one thing we really have to be judicious with each site that we pick, because it's going to be close to $10K per spot.
Mm-hmm. Well, thank you again, Jeremy.
Yes,
Thanks for having me.
Yeah, thank you.
All right, for our next video and Q&A, we have Ionia Casey and her project. The project name is Melwell. So let's hit it.
Hi, everyone. Welcome to the Thrive Tulsa Impact Showcase. Thank you so much for taking the time to watch our presentations and learn more about our impact projects. I'm excited to share with you guys a little bit more about Melwell, an initiative focused on the wellness of Black people who are commonly underserved and underrepresented by the wellness community. My name is Ionia, and I am a personal advocate of mental wellness and holistic wellness. I was diagnosed with depression and anxiety in 2017, but I didn't begin therapy consistently until 2019. And this is when my research on wellness really began. I shifted my focus from physical wellness to mental wellness. And that's when I realized that those two are connected. When I focus on the wellness of my mind, I saw the positive reaction in my physical body. So you may be asking, what problem is Melwell actually solving? Black people face immense generational and historical trauma. It is important that we know how to heal so we can live well. For generations, our ancestors championed for freedom, justice, and equality. As this fight continues, what is irrefutable is the impact on us physically and mentally years later that has been passed down from generation to generation. Here's some important facts to know. 13.4% of the US identifies as Black or African American. 16% of those have dealt with mental illness in the past year. And Black and African American people are 20% more likely to experience mental health issues than other races. Things like our exposure to violence, whether we're victims or witnesses, really does increase this risk. It's important to understand our history as Black people and how it's affected our mental health and overall wellness. Racism impacts our mental health. Negative stereotypes and attitudes of rejection have adverse consequences. Historical adversity like slavery and race-based exclusion from things like healthcare, educational resources, social and economic resources translates into socioeconomic disparities experienced by Black and African American people today. Socioeconomic status is linked to mental health. People who are impoverished, who are homeless, incarcerated, or have substance abuse issues are at higher risk for poor mental health. Suicidal thoughts, plans, and attempts are also rising among the Black and African American population, specifically in the 18 to 25-year-old demographic. 9.5% of those identifying as Black or African American in that demographic had serious thoughts of suicide in 2018, compared to 6% in 2008. Mello wants to eliminate the stigma and misdiagnosis of mental illness among Black people. Research indicates that many Black and Brown people believe that mild depression or anxiety would be considered crazy in their social circles. We are more often diagnosed with schizophrenia and less often diagnosed with mood disorders compared to white people with the same symptoms. The goal is that Melwell will curate safe and representative spaces for Black people to learn and participate in holistic wellness practices and modalities. Melwell spaces will be inclusive of all races while focused specifically on the livelihood and historic traumas of Black and Brown people. Melwell is an answer, not the only answer. There are many similar initiatives happening all over the country. Melwell wants to close that gap here in the Midwest. So some of the practices that will take place in these spaces are things like meditation, yoga, energy work, group talk, and education on food wellness and different plants and oils. Do you want to get involved? We would love for you to be a part. You can connect with us on Instagram at melanin.well, email us at melanin.well@gmail.com. If you're a holistic wellness practitioner, an instructor in healing modalities, or if you just have really great ideas that would contribute to this initiative, we would love to continue the conversation. Please get in contact with us. Thank you so much for taking the time to listen to this presentation, and I really look forward to continuing this conversation.
Another sort of health-based project idea, reminding us of just the constant nature of systemic racism in America and its cost on people.
Yeah.
So, well, I mean,
impact of trauma,
yeah,
and how it can create mental issues, but also can create a stigma around those same mental issues.
yeah. Well, let's bring Ionia in and let's ask this question. Hello.
Hello.
Hi guys. Can you hear me?
Yes,
we
we
can.
can.
Okay,
So,
great.
I mean, I know half of this answer, but I'm gonna ask it anyway, which is, so why this idea and why here?
Well, to not sound repetitive, I suffer from depression and anxiety since 2017 or about 2017. And, within my circle, within even my own family, the idea of therapy is just like, oh, you're crazy. Something's, nothing, you're not crazy. It's like nothing's wrong with you. You just need to, go to church or something. And so it wasn't until I really found therapy and committed to it. It truly, I tell people it saved my life. And I don't mean that in a I'm not over exaggerating. It literally saved my life. And from therapy, I went on to learn about other different healing practices and holistic wellness and different things like that. And so what I've learned from just talking to friends and family is that really as a culture, we are not taught about therapy. We're not told to go get, help, or it's okay if you're struggling or you're dealing with depression or anxiety and things like that. And so we really battle. And so when I was started to do my research and really looking at the connection and the rise of things like suicide rates and the connection of our historical trauma and dealing with different mental illness, I realized there has to be something, there has to be a change. We need to create a space for people to come in and really learn how to heal themselves in a holistic way in relation to the trauma that we as Black and Brown people experience on a day-to-day.
So I know a lot of times, with therapy, historically, it has been designed and trained and taught to gear towards, frankly, helping white people, right? And you talked about the diagnosis differentials already. And so what about this wellness program and creating a space specific for Black and Brown people? Why was that important to you and to the success of this program?
Well, while I was in therapy, like I said, I started discovering some other holistic practices. So I would go and do yoga and hear my yoga teacher. I'm usually the only Black girl in the room. And then my yoga teacher is saying, okay, let's breathe out all the busyness of the day. And it's like, hey, I just actually watched an innocent Black man be shot by a police officer. So that's actually what I'm dealing with. That's what's stored in my muscles and my spirit and my chakra. So how can I work that out, right? And so for me, it's really curating spaces that doing those same healing practices, meditation, yoga, energy work, those different things, but really focusing it in on what Black and Brown people are experiencing every single day and in relation to our history that has been spiritually just passed down from generation to generation. And so making it to where we feel comfortable to go into those spaces or being in those spaces and learning about those things because they're relative to our experiences.
Have you found, because there's a stigma around therapy, that there's, on top of the already existing problem of not as many Black or African American doctors in general, that there aren't a lot of Black or African American therapists for people to go to?
For sure. I unfortunately was not able to have a Black therapist. Thankfully, though, my therapist was very well trained in handling the historical traumas of Black and Brown people. So I really lucked up there. But for many people, it's not the case. And so even trying to, I've even kind of curated a list in my notes app for my friends that when they come to me and they say, hey, I need therapy, I send them a list of all the Black therapists that I've just been kind of collecting, like a little database, because they are very few and far between. And what I've also found is that majority of them are religious based. They're Christian therapists, and not everyone desires that, right? So where can I just find a Black therapist that can just help me work through the things that I'm dealing with on a day-to-day as a Black person in America?
Well, how can we as two white goobers help you?
Well, I would love to talk more about Melwell on the podcast, and that'd be great. And just, really sharing some of these facts that maybe a lot of people really don't know. I didn't realize that Black people are more often diagnosed with schizophrenia over mood disorders. That was new to me.
Yeah,
so so sharing that information in your circles, and if you know of people if you know of Black therapists or Black healing practitioners and things like that, share them with me, and I'd love to, kind of get that out as we create this network.
I feel like it's almost like a double stigma, because I feel like there's a general stigma about mental health and getting therapy, and then on top of that, the oppressed groups' feelings like they have to tough their way through everything, and it's very hard to fight through that. So I think that programs like this are an incredibly useful, helpful thing. So
100%. And like I said, there's actually very similar programs happening in other parts of the country. There's a program called Heal House that's in Brooklyn, New York, that I actually discovered about a year ago. And so we just don't have it in the Midwest. And so it's just kind of time for this part of the country to really kind of catch up and really make sure that we are taking care of our Black and brown folks, because we're still, fighting inequality every single day, and it's traumatic. It really is. And so how can we make sure that we're taking care of each other?
Well, thank you again, and I know we flashed up the email address a couple of times so that people can connect to you if they have any resources or ideas. But thank you very much for being on and telling us all about your program. And
Thank you,
hopefully we'll have
guys.
you on our podcast soon.
Oh yeah, we'll be in touch.
Yes. Thank you, guys.
Thank you.
Well, that was fascinating.
Yeah.
I mean, yeah, you don't think about like the different diagnoses that would happen per groups. Like that's not something you, unless it's pointed out to you, it's not something it's knowledge that's just out there.
Yeah.
So.
Unfortunately, like many things, it was another tool that was unfortunately used for oppression.
Yep.
Often, not to get too pod for sad.
I know.
Maybe we should just go on to the next,
Yes.
next project.
Okay. So our next presentation is Dwayne Dickens, and his project is called Telsons Helping Telsons at TCD.
Hello. I am Dwayne Dickens, the Director of Diversity, Equity, and Inclusion at Tulsa Community College. And my project today is Telsons Helping Telsons at TCC. The issue or challenge the project addresses is that our students face many life circumstances that hinder their graduation. And with any community, we have limited resources, limited staff, limited funding, but we know that together, when we bring the community together, that we can solve any problem. And so my project is based on pulling the community together and creating a mechanism that gives them a pathway so that their voices are heard, and they also have an insider pathway to contributing in with resources, with suggestions, and once they understand what the student needs are. Timeliness and networking are key to this type of community support. We need to help the student when they have the need, not the semester after they've already gone through the need. And so the goal is for us to be responsive to those needs and get the community engaged at the beginning when the students are encountering those challenges. So there's an internal think tank within TCC and an external one within the greater Tulsa area. Why this project matters to me: I have been in developmental education. I've been faculty for more than 20 years at the college, and now I serve as a diversity, equity, and inclusion director. And when I think about students, I don't just see a number. I see mothers, I see fathers, I see sons, daughters, and I see grandparents. I see all sorts of individuals who represent the variety of underrepresented students that we have within the institution who I want to see succeed. And so with that in mind, another aspect of my desired connection is so that the community feels more like an insider when we're trying to solve problems, so that they can have a place to sit down and share, these are some of my suggestions, and they can go through our diversity area and we can hear them, create the mechanism where their voices can be heard. We don't want them to just be bystanders, using that sort of bystander effect of maybe I'm too busy, I'm sure someone else is taking care of it, and I don't want to be presume that someone doesn't need help, and I don't want to get involved. So now it is our business as a community to care for one another, and this is a mechanism we can use through these two think tanks, the community one and the college-based one. When I think of the coaching and mentoring that we already do, we focus on where there are gaps in achievement, where there are gaps in representation, where there are gaps between where we can look at them. For example, with race, we can see the genders and race put together, that we have some wide disparities between students, whether they're male or female, just looking at those two with race. And we can see that we range from 13% to 38% for 2-year graduation rates. And we want to address those items up front. And we know that we can, with the community, come up with some ideas for how we could tackle these types of barriers together. So we look at the retention between and within each semester, as well as persistence to graduation or to a different institution. So these are all important, and we want to be part of that through our think tanks. And the think tanks fit in through the college, through our office. They go through our Student Success Council, our vice presidents and a dean, all the way up to the president of the college through the president's cabinet. So decisions will be heard, and we will look at them and work on ways to implement what would help our students be successful. We want a diverse set of members throughout the community and within the college. We want students and faculty, and we want ministers, we want Native Americans, Hispanic, Asian, people from across the gamut of Tulsa to be part of this meeting bi-monthly and working between equity to justice to success for our students. We've already started the internal think tank. We've sent out invitations in October, and we are also today just beginning this initial public sharing for the community part. You can serve as a community leader on the think tank. You can bring your suggestions. Maybe you'll be a career mentor. Maybe your knowledge of community resources would help us identify how to help students when they're dealing with housing issues, utility payments, affordable child care, car repair, or financing. We together can remove the barriers that our students are facing. If you want to be a career mentor or be a think tank member, please reach out to me and I will get you connected and involved. My email is dwayne.dickens@tulsacc.edu. If you are fortunate enough to be able to have funding resources, please contact our TCC Foundation at tccfoundation.org and make a comment that you want to support diversity programs. Thank you so much, and I look forward to hearing back from you for our community of Tulsans helping Tulsans be successful at Tulsa Community College.
I mean, I'm fascinated by this idea because we always talk about how local problems aren't necessarily local, but yet to fix each individual problem, you kind of have to know what's happening in the place. And so this sort of really applies that to a particular problem. So I'm excited to talk to Dwayne. Dwayne, are you with us yet?
I am here. Yes, I am.
Hello. Hi, Dwayne.
Hello.
How you doing?
Hi.
So you are involved in a lot of nonprofit work in town. So why this? Why Tulsans helping Tulsans?
Well, obviously, part of my work over the years has always been to help students. I'm committed. Whenever I go anywhere, someone is going to stop me about how do I be successful at TCC? How do I get my child, my grandchild to be successful? How do they get into TCC? So the community's already coming to me and asking how can we get help? But providing this mechanism as an advisory think tank provides an opportunity for not only the community members to find out exactly what are some of the challenges we're facing, but also how they can be instrumental in shaping how those programs look and even giving feedback on what's working, what's not working, and then we can push that forward on a larger basis to the rest of the college. And admittedly, I work within the diversity, equity, and inclusion area. And so the highest needs for those who are not being as successful as we want them to be will be based a lot on those who we would normally categorize as under diversity. So that's the group that we typically work with. So we need a committee, a group of think tank members who can say, let's address that specific group and give feedback on what would be helpful to them.
So how do you make sure that your think tanks reflect the diversity that you want?
That is a great question. And so the way I typically want to approach this is I have a list for the community portion, I have a list of what would be ideal community partners based on organizations, based on representation. And so we reach out to them, although that may not be the exact composition, because maybe I want to go to someone who's in Catholic Charities. That's an example. And maybe they just don't have the capacity to be part of the advisory think tank. But we start with an ideal list that represents a sort of diverse group of individuals. And if we don't get them, then we go find someone that can fill in that gap where we need them. And so just starting with a template that's already diverse by design, and then trying to make that happen. And when it doesn't happen with that design, then trying to fill in a substitute.
So how can both the people watching on the live stream and Chris and I help you in this project?
Well, what you're doing right now is certainly we want to broadcast that as much as we can. And naturally, I'll be reaching out to that diverse group as well. And of course, if you are interested in being part of an advisory think tank, we would love to have you be part of that. It's just really, and there was one component that, of course, I don't want to define what the advisory team is going to bring together. They're going to give us recommendations, and then when we push those out there, being supportive of what they suggest for the community would be helpful. And there's always, as one of my friends always says, money is always helpful for the diversity work that we do. So always feel free to donate and target it directly to the diversity work so that we can have great ideas. But if we have great ideas and zero budget, it's hard to implement them. So being helpful in that capacity, $10 is helpful every time it's given, or more, of course.
So we have a question from the audience. Jesse, do you want to take
Yes,
that?
I'm trying to read it at this distance. So,
all right, if you can, okay, Dr. Dickens. Okay, considering the challenge facing education, what keeps you hopeful for a better future for Tulsa?
Well, what keeps me hopeful, one, when I encounter students, we're at the final exams right now. And so the students themselves give me a great deal of hope, especially when what we're already doing, we see how they're benefiting from the work that we already do. In terms of just a meeting that I had today with several success coaches where they tell me examples of students who needed a plan, and they gave them a plan, they worked it, and they are able to talk about those successes. So the students themselves give me that hope. But then where I can also see where sometimes the hope that we're giving to them is because of the collaboration, the partnerships from community members who are saying, we specifically want to help students using the diversity office. And they're saying, please, here's the funding. Here is the volunteer work that I will do that will promote helping in the diversity issues that we know we're facing in higher education. So if I've seen some models that are working from the community partners and from the students themselves, we simply want to scale up the community input and activity, and scale up what we can do with students directly.
well, Dwayne, thank you for, again, just in general, all the work that you do, but thank you so much for joining us tonight and for this really fascinating idea. And I'm always happy to serve on any advisory board. I'm always happy when people give 2 cents about what I think.
Do you have enough advisory boards?
That's true. Never mind. I take that back.
Make space for other people,
Dwayne,
Jesse.
you can take me off one thing and put me on another thing if you need to. How about that?
Yeah. All right. Well, thank you very much. And your email address is flashed on the screen a couple of times. So hopefully people who are interested can connect directly with you. Thank you again very much.
Thank you. And thank you to Thrive Tulsa and Leadership Tulsa for this great opportunity.
Yes.
All right. So our next video and Q&A is from Meg Chang, and it is a problem for creative platform. Sorry. Everything is far away from me. Platform for creative longevity options.
Hello, my name is Meg Chang, and I'm very happy to share with you my Thrive Cohort 4 presentation, Options for Creative Longevity, because creativity helps us live longer and more enjoyable lives. why this is important now, because of the aging population and because we age. It's a fact of life. So the goal is to create a multi-generational, multicultural, inclusive, and diverse environments. These are stimulating, alive, and the way that our world is configured now. I'm personally invested because I've witnessed and experienced the benefits of creative arts psychotherapy from various perspectives as a teacher, as a practitioner, and as somebody who designed a program in my mother's memory care unit with a good friend of mine, Donna Newman-Bluestein, developing a program for caregivers based on nonverbal communication and creative movement. It would be creating a not-for-profit organization focused on the well-being of all people involved in an intergenerational environment that provides non-institutional elder care. The values, of course, are at the center of this, and this is a project that is mapped out with this mind map, and you can see we've considered legal and regulatory issues, certainly business issues, ethos and values of the community, where this might reside, the scale of it, clinical and theoretical issues, so that services would be provided by creative arts therapists along with other professionals and paraprofessionals. And then, of course, who would want to be part of this, residents or taking part in the activities. So, challenges. Of course, always physical environment regulatory agencies are at the forefront of anything dealing with people. And the objective, though, is to gather an organized network of care providers through national recruitment and through developing local talent. Continuous improvement and staff development is necessary to continue to reinforce the values. And implementation of this has been, my understanding of how to implement this has been greatly enhanced by invaluable conversations with the Leadership Tulsa Thrive cohort, with the facilitators, Marisa, Michelle, Donna, and Wendy, and I thank you all. And so I realize that it's necessary to pilot creative art therapies in current Tulsa facilities, to identify research partner organizations or join ongoing research, to contribute to the research about creativity and aging that is quite robust and continues to grow. And the goal is to to create an environment where creativity and artistic process are at the forefront of daily lifestyle. Thank you very much.
Well, that one's very interesting. So I'm just gonna jump right in. So let's talk to Meg. I've got questions.
Yeah.
Hello.
Hello, welcome.
Hi, thank you.
Thank you for joining us.
Yes.
Happy to be here.
So
apologies to Marcia. Let me just say that right off the bat. My brain just sort of went off track there, but
Listen, you don't need to apologize for that. So
That's all right. We all make mistakes.
We do. We all go on tangents, especially when Marcia is
Yes.
involved. So I guess my first question is, why do you think this has a chance to succeed here in Tulsa?
well, that's a great question. I'm not sure, to be honest with you. I mean, I can't think of any aspect of life where some sort of creativity doesn't improve it. So I think that one of the things about as I've been in the Thrive program is looking at different ways of implementing this. So one way might be something very kind of minimal, like going into a facility and providing music therapy, art therapy, dance therapy. But then the other, which is sort of where I started, was like, well, what would it be like if there were actually a community where these services were like really like, you could go down and just go into the art room and do some art therapy and have creative art therapy all the time sort of be available. And as people got more severely kind of regressed, as they say, have the interaction be with creative arts, people who really understand symbolic communication and imagery, rather than attempting to talk to people who have dementia, which is usually just like kind of a non-starter. But why Tulsa? I don't know why, because I think Tulsa is a very accessible community in a lot of ways. And I think that there are, and I've talked to wonderful people who always have these great suggestions and ideas. So I sort of feel like, wow, I'm not used to that much kind reception.
Have you been able to connect with any local community organizations like, say, like Life Senior Services or similar to try to implement this program?
Well, that is definitely the next step. That's definitely the next step. Yeah.
I mean, so a lot of the projects tonight have been, a couple of them have been healthcare related, and they've been about how, certain communities have been or are still being ignored in certain areas. Is this another issue where BIPOC people have even less access to this particular thing?
Well, unfortunately, yes. And it's sort of ironic in a way, or that's probably the wrong word, but it's actually BIPOC communities are the communities that naturally use creative arts therapies in daily life. And yet when in many of these facilities, particularly the ones with creative arts therapists who come into the facility, they are sort of upper income, white, middle class facilities. But I actually would that's why my model has to, for me, it has to be diverse and inclusive. So whatever facility or environment it is, it would, I just can't imagine having it be monoracial, monocultural, But that's a great question. Thank you.
So I know your focus is, in your presentation, you talked a lot about helping with dementia patients and similar. How does this help more broadly with people as they begin to get older? How can arts help them continue to live a full life?
So creative art therapy is basically using any one of the arts as a psychotherapy. So to kind of piggyback on what Ionia was saying, that is just as we are going through life, and particularly as we're aging, there are issues and feelings that come up which can either evade being talked about because they're more subtle, or using one of the creative art therapies, you can actually sort of create and imagine and envision some potential good outcomes through a picture, through a song, through working together, singing together with people. So it's I guess I'm just thinking of it as kind of an enhanced psychotherapy.
So how can people connect with you and help out with this project?
Well, I need help implementing. I need help getting things going and moving. And I think one of the really great ideas that came up was the idea of perhaps starting with a pilot program that would be a research program. So I actually could use some research partners if there's anybody who's doing ongoing research right now in the senior community, either using the arts or looking at different kinds of forms of interventions. I'd be really interested in joining that. Or if there's anybody who would like to partner with me to put together a project proposal. I really need to have like that next step connected.
Mm-hmm. Absolutely.
Luckily, one of the great things about Tulsa is you're like one email away from that person. So we'll do our best to help connect you as much as we can. And,
absolutely.
thank you for
Thank you.
Thank you for joining us tonight.
Yeah, thank you.
So, all right. Well, so now we are moving to our last two of the evening, who sadly both of them cannot join us tonight. So we're just gonna be watching their presentations, but I'm still excited to see them.
Yeah.
So let's move to Amy Hernandez and
Blue and
project's name of
Purple.
Blue and Purple.
Hello, everyone. My name is Amy Hernandez, and I am a proud member of Thrive Tulsa's 4th class. For my project, I created the Blue and Purple Project, which aims to highlight the intersections of human trafficking and domestic violence, and to motivate domestic violence service providers to include services for survivors of human trafficking. This project is important to me because as an advocate for survivors of human trafficking, I've learned that survivors have a really difficult time accessing resources and accessing safety. This is because our community simply doesn't have enough resources to meet the needs of our survivors. However, our community has done an incredible job of providing services for survivors of domestic violence. So by highlighting the commonalities between human trafficking and domestic violence, I hope that eventually agencies that provide services for domestic violence survivors can also provide equitable services for survivors of human trafficking. My specific target audience for this project is domestic violence shelters. And my first step in the project was to assemble a crew of allies. So I reached out to 3 of the most incredible and powerful women that I know. Molly Bryant is a professional in domestic violence and a wonderful advocate. Lindsay is a family law attorney who has specialized in identifying human trafficking elements in domestic violence cases, and Eva Stencil, who I think is the most important person in this project, is a survivor of both domestic violence and labor trafficking. When she married her ex-husband, he was abusive in their marriage and trafficked her at the same time. So Eva embodies the reason that it's crucial that domestic violence service providers know how to identify and address human trafficking related issues within their own agency. Eva is a living example of how human trafficking can and does exist within domestic violence cases. Together, we created a presentation specifically for domestic violence providers. The presentation included statistics, legal considerations, and first steps that need to be taken in order to get certified to work with survivors of human trafficking within a shelter. We ended our presentation with Eva's incredible story of survival. She specifically highlighted her need for support from the community and her inability to access adequate services at her time of need. So we launched our project at the Partners for Change conference. Now, the Partners for Change conference is a statewide conference for domestic and sexual violence service providers in the state of Oklahoma and surrounding areas. And the presentation was a huge success. We got great reviews, and most importantly, we met with representatives from domestic violence shelters across the state of Oklahoma that expressed interest in expanding their services. So our next steps is to continue to have these conversations until we've reached all the domestic violence shelters in the state of Oklahoma and have convinced them to expand their services to include human trafficking survivors, and to start collaborating with those agencies who feel prepared and ready and eager to obtain their certification and expand their services. Now, we are so fortunate to have the only 2 OAG double certified shelters here in the Tulsa area, which means that we as a community have already started paving the way and can lead this change right from here at home. So as Blue and Purple project grows, I'd like to create a step-by-step guide that shelters can use in order to obtain their certification and provide adequate services for survivors of human trafficking. I'd also like to be able to provide tips and tricks that the current domestic violence human trafficking shelters have learned through practice and through experience, so that as domestic violence shelters start expanding their services, they don't feel like they're having to reinvent the wheel. My ultimate goal with Blue and Purple is to have every domestic violence shelter in the state of Oklahoma open their doors to survivors of human trafficking as well. I have so much hope for this project, and I'm so grateful that Thrive was able to provide this opportunity and motivate me to launch this project. this project is going to have such a wonderful impact for survivors of human trafficking. So thank you, and special thanks to Michelle and Marcia. Now, if you're at all interested in getting involved, if you're a current provider, if you're interested in expanding services, or if you have ideas to share or want to learn more, please reach out via email, hernandez@dvis.org. Again, I am so eager that I was able to work on this project and so eager to keep going with it. Thank you so much for the opportunity.
Wow, that was quite a video.
Yeah.
And, a topic that, one of the things we learn a lot about in Thrive is the impact of intersectionality on so many problems. And this is one that, we've talked about a lot, should be obvious, but it's something I never really thought about, the intersection between human trafficking and domestic violence.
Yeah. So the people willing to do one are obviously capable of doing the other, and that happens quite often. And it's not something those shelters are prepared for. So
Right. So thank you, Amy. Amy's contact information is up on the screen for anyone who wants to connect to learn more about this program, this project, and how they can help.
And for our last project of the evening, we have Austin Backus and Curiosity Club. I'm curious about this one.
I'm going to club you.
Hey, my name is Austin. I'd like to take a minute to share a community program that I've been working on. Growing up, I learned and heard frequently that curiosity is the essence of humanity, of human nature. And with that, I pretty much agree. We always have the joke, right, that toddlers are always asking why. I have 2 toddlers. They ask that question a lot. But I think it's really important in understanding who we are as a species. What is it that we focus on? We ask questions of the sciences and of natural sciences, philosophy, psychology, but we also ask questions of science and technology, right? Magnetic fields kind of blow my brain a little bit, but they've existed ever since the Earth's been around, and these magnetic fields are really important to electricity. I'm an electrical engineer, so that's why it's always so interesting to me. Growing up, I love to tinker. I love to take things apart, put them back together. I like to build with Legos. I like to play with Lincoln Logs. I like to figure out how things worked. I had a family that supported that. I have 3 older brothers and a twin sister. My twin sister is also an electrical engineer, and 2 of my other brothers were mechanical and software engineers. So I've got a lot of engineering in my family, and that created a good environment to learn and ask questions, a safe environment to do so. But I also found out, through growing up that not everybody had that opportunity. So what I want to be able to do is provide that opportunity for individuals of all ages, children, young adults, to be able to explore STEM, ask questions they've always wondered, look for solutions that they think are there, and then go test them. The main objectives of the Curiosity Club would be to develop equity of access to STEM projects outside of school that are applicable to our daily lives. I know we've all probably heard of Pythagorean theorem. It's probably pretty hard to understand how Pythagorean theorem even helps you if you haven't learned calculus. So it's a good example of where we learned STEM, but we didn't figure out how it applies to our life. And I'm probably like y'all in that if I don't learn how it applies, it just goes in one ear and out the other. Another objective of this group is to allow flexibility within the group, to allow participants to lead the conversation. Right? We want individuals who come to the group to be asking the questions and taking the initiative. It doesn't need to be something where individuals are coming, they're filling out a worksheet and leaving. We want to create dynamic and agile projects that can change or they may not follow specific step-by-step procedures. I want students asking questions. I want students to feel empowered to feel like they can go one direction instead of another. Especially when you're looking for answers, you may end up going 6 different directions. So I want those participants to feel empowered to explore that on their own. So what does this club look like? It looks like meeting once or twice a month. at a community center, a rec center, could be in a school gymnasium, to line out a project, do Q&A, brainstorming, look up possible solutions. It could be something that's simple and happening, something that's really easy to do in one go, but it might also be something that's complicated that takes several months to resolve. I want to be able to provide resources for participants when they come and say, hey, I really want to build something. I need a computer that runs it. Well, for example, you could get a little Raspberry Pi. They're not terribly expensive, and it would be something that I would want to be able to provide to individuals. I'm an electrical engineer, so if there's technical support, hey, maybe I can help out. If I can't, let's look at universities, TTU or TTC or TCC, excuse me. Let's look for solutions around us. Let's look at libraries. Google is a wealth of knowledge. And finally, I just want to encourage students, participants to take the initiative in leading this. To get involved. Currently, safety is our priority, and so we're delaying the initiation of this until vaccines are available for all ages. I have 2 toddlers, so we don't want to introduce risk where risk doesn't exist currently. Once that is lifted, once we understand that the vaccines for COVID are available for everyone. Outreach will be through schools, STEM clubs at schools, libraries, community centers, etc. The initial group will most likely be limited to young adults or adults, depending on that location. So my name is, once again, Austin Backus. Feel free to reach out to that email. If you send me an email, I will put your name on a contact list, and I'll send out information when those dates and locations are determined. The goal here would just be to allow STEM to become a part of people's lives in a way that can really impact them, and hopefully in the end will generate a little bit of community too.
If you have something, I was just gonna. Hello. All right. Well, listen, I would love to do some STEM projects outside of school. I miss school and I miss doing projects. So, and hopefully Austin can connect with the new Discovery Lab. So, well, that's been the showcase. I've enjoyed it. Wow, someone's phone just buzzed very loudly in here. No one heard that but us, but
we'll kick it over to Marcia to wrap things up. Jesse's rambling.
Yes.
Well, thank you so much for joining us this evening. As you can see, again, what an amazing time to be a part of our Tulsa. Again, Thrive Tulsa was comprised of everyday Tulsans from all different walks of life, folks that are new to Tulsa that want to give back to this amazing community, and folks that have been here for their entire lives. And it makes me hopeful in raising a thriving Tulsa for my children. I definitely want to thank our company sponsors, our corporate and community sponsors. I believe there they are. These are just some of the most amazing organizations in our city that have invested in the success of collaboration in addressing these adaptive challenges that you heard here today. Thank you so much for joining us. If you want to know more information, please look at our website, leadershiptulsa.org. And I also encourage you to engage and plug in. Later on, when you watch these videos, if you heard something that really resonated with you, please reach out to the contacts that you've seen, or reach out to us at leadershiptulsa.org, and we can make that connection. Because really, these ideas, we're about breaking the silos. Together, the more that we know, the better that we can do, right? Thank you again for joining us tonight. Thank you for the philanthropods for Pod for Good, both Chris and Jesse. We appreciate you for just continuing and closing the loop of alumni engagement so that Thrive continues getting the word out, and we keep getting just amazing leaders that contribute to our city's success.
And like all of the presenters, I would also like to thank you and the whole Leadership Tulsa team for just being amazing teachers, partners, and, I don't know what the third word is. Do you have a third word? Just being wonderful human beings and wanting to make Tulsa a more equitable and diverse place. So thank you. Thank Leadership Tulsa, the building, and all the people who work here. So good night, everybody. Yes?
Thank Ed.
Oh, Ed, thank you.
Ed Shar and
Ed.
Michelle Lara, thank you
Yes.
so much for your work.
Good night, everybody.
Good night.
Bye.